Hey everybody, this is Dr. Erin Harris. I am actually filming on my front porch outside because I wanted to get some air and some vitamin D and get outside. It's this hot day outside and we wanted to go poolside. So honestly, if you hear a lot of my kids making a lot of noise, please forgive because they are having fun tonight or today. It's not tonight, but we're going to have fun tonight and today. And so I just wanted to really get outside and get some vitamin D, which is good for your immune system. And so I really thank you guys for coming on and watching the videos and getting more information about not just vitiligo, about chronic disease in general, but I also want to also give you a platform to learn about the principles that actually were really important in my healing, which is functional medicine. If you guys don't know, I'm a physician and I do practice functional medicine. And I was trained in internal medicine and later on became certified in functional medicine through the Institute of Functional Medicine. And if you also don't know, I started experiencing vitiligo in my 20s, and it progressed as a medical student and an intern and became very severe in my late 40s, and I started experiencing a lot of color loss during that time. So I looked and found on YouTube uh, a person who was healing from vitiligo by doing supplements and vitamins, and I thought that was just unheard of for for a physician. I never, never heard that because we don't get a lot of training in nutrition and and no nutritional training in medical school. So I want to provide the same principles that I was trained in and all the same principles I use to treat my patients and give that back to you on YouTube because you guys may not be able to find a functional medicine physician. There may not be a functional medicine physician in your area. And so I can give back to you guys and provide some of that information. And we'll just go month by month or whenever I put on a video, we'll go and give you that information so you will be able to use those principles for your healing. So that's what we'll do. So, one of the things that I want to start off with is just what is functional medicine. A lot of people really still don't know what functional medicine is, and that's okay. But I'll go ahead and explain that for you. So, the one thing that a lot of people think that is functional medicine is just holistic medicine, and you're just taking supplements and you're giving people supplements. There's a lot of expensive testing, and you're giving people supplements uh, instead of giving them medication. And it's part of it. That is part of it, but it's much more than that. So functional medicine, we're doing a deep dive into uh, the why behind your chronic illness. It could be vitiligo. It could be eczema. It could be ulcerative colitis. It could be diabetes or high blood pressure. But we're really trying to figure out the why behind your chronic illness and not just give you medications, not just give you um, not just say there's nothing that we can do about it, but actually try to help you heal naturally, lifestyle, diet, um, rather than giving you medications for it. When we say root cause medications, that means that we're really trying to find the biochemical, physiologic, molecular cause of your chronic illness and then treat that instead of actually just treating your symptoms and making your symptoms get better. Instead of just giving you a medication for constipation, we're actually trying to find out why you're constipated. And instead of giving you a medication to heal your eczema and make this rash go away, we don't know why are you having eczema and why are you experiencing this rash every time that you eat a certain food or every time that you stress out. Also with vitiligo, we want to know what happened, what started this whole process, and we do a deep dive into your family history, your personal history, your medical timeline, and try to find out the why behind your chronic illness. And so that's basically what functional medicine is. We use all those principles of uh, your genetic history, your uh, what's coming up with you physiologically. What do your labs look like? We do functional testing. We do a lot of stool testing, nutrient testing. We also do genetic testing. We also do hormone testing, just to figure out why you're presenting the way you're presenting. Why do you have chronic fatigue? Why do you have joint pain? Why do you have arthritis? Why do you have multiple sclerosis? Why do you have Parkinson's disease? And so we're really trying to figure out the why behind that and not just give you a medication to cover up. And so what functional medicine is not just taking a supplement and giving you a supplement instead of a medication. Supplements do help, but we really do start with foundational things like how are you sleeping? What are your relationships like? What are you eating? What's your stress like? What happened when you were 7? And how do you heal from that? And so we take all of that and use those and change lifestyle, change the way you eat, pull some things out of your diet on top of supplements to help. And sometimes you may need medication. Like if your blood sugars are very high, you may need medications in order to control things before you get things under control, where you can just control things by your diet and lifestyle. So we do use supplements, but it's not the all in all for what we use. We use all of those things to help you heal. One of the things I will warn you guys is taking information from people who are not trained and properly trained in functional medicine. Usually, you see people who are properly trained, they have credentials such as a medical doctor or a naturopathic physician or a ND. A naturopathic physician is an ND, or um, uh, a DO, which is a physician who is an osteopathic physician. So I would really take information from people who are trained in medicine and had significant training in medicine, rather than taking information from an influencer or a motivational speaker or someone who's pushing just a supplement, even though it is a physician, saying that this one thing can heal. I'll be really weary of that. I would also do your due diligence and really look into if a person says they're a physician, but they may, or a doctor, but they're maybe like a doctor of philosophy and say they're a functional medicine practitioner, because maybe they took one course. Functional medicine training is very intense, and it took me 2 years, and I have the sleepless nights to back it up. And I studied and did course study and took the exam and did a case study in order to become trained in functional medicine and certified to practice functional medicine. So make sure that your person that you're seeing or your person that you're taking information from has true training, has significant training, either integrative medicine or IFM certified, that have some type of additional training in functional medicine. I would be weary saying that someone is a nutritionist and they can give you the same kind of vast amount of medical knowledge that a physician says that they can give you. So with that, we are definitely going to continue this whole process of looking into functional medicine, the foundations of functional medicine, what we use to help you guys heal. You guys, again, may not be able to see a functional medicine physician, but these principles will help. So the other thing that I am going to do is I'm going to give you a chance to comment below, and I will answer your comments at the end of every video. So make sure you guys leave your comments in the comment section, and I will answer some of your questions that you have. So one question is, I think on my last video, I had someone ask about medication. Oh, no, not medication. She asked about makeup and what do I use for cover up. And so I try to stay clean because a lot of people who have autoimmune diseases have problems with toxic clothes. And so using a lot of makeup is really full of parabens. Your skin is an organ, and it absorbs anything that you put on it. It absorbs toxins, it absorbs nutrients, it absorbs medication. It can absorb water. Your skin is an organ, and so you need to make sure that what you're putting on your skin is clean. So I choose to use, and I don't use makeup a lot, but it's when I'm going out or going somewhere special, I'll use makeup. but I use Bare Minerals Bare Pro. With Bare Pro, it gives great coverage. It's 24-hour coverage, and you have to only use it once on skin where you don't have color loss, but where you do have color loss, I tend to build up the coverage. So I'll put it on, let it dry, put on another layer, let it dry, and put on another layer until it matches my skin color. But it does great coverage and it's clean. It's very clean makeup. Well, it's not very clean makeup, but it's clean enough where I don't mind using it every once in a while. So that's what I do use. And there was another comment about light treatments. And so one person asked me about light treatments. What do I use? I actually use a light treatment that has 4 panels, and you usually have to get that light treatment from as a prescription from a physician. And the 4 panels just open, one panel opens up, another panel opens up, and I just stand in front of the light treatment front and back, and that's how I use the light treatments. I would get a protocol from a dermatologist in order to use light treatments, but I do use light treatments when I am going through my healing process to restore my color. You really do need some type of light to restore your color. So in addition to using light treatments when I am actively treating, I make sure that my diet is on point, and we'll talk to you guys about later. Making sure I'm taking the supplements that I need to take to heal, and also make sure I'm getting enough sleep and exercise. So it's light treatments is you can heal, but you'll lose the color if you don't do all of those principles. So the principles of functional medicine, like I told you about. So you guys, please like and comment in the videos, and I will definitely see you next time. Also, I forgot to tell you, I am going to do a webinar series. It'll be the second Saturday of every month at 10 a.m. And I'll put the link in the description so you guys can join me live. And if you have any questions about vitiligo or any other chronic illness that you want to ask me about live, we'll go over these same principles of functional medicine. I'll be teaching, my patients will be on there, and other people will be on there, and we can give you, that would be a live question and answer for you to, answer your questions for me. You can't see me in person, so you can join me on a webinar. So we'll put that in the description, and hopefully you guys can see me on the webinar. So I enjoy doing this, and I'm glad I'm doing this again, and it's a great way to just provide you guys information. So until next time, I'll see you, and we'll talk more about principles of functional medicine next time, along with why should you use functional medicine principles instead of just conventional medicine. Okay, all right, see you guys later. Bye.